getting a little bit into it, but if Saphnelo did join Benlysta and Lupkynis as an approved treatment for LN, how would you see those three drugs fitting together with everything else that is used to treat the disease?
I mean, I think part of it will be that we use what's familiar to us. So we're going to use belimumab first because we're familiar with it. When are we going to try anifrolumab? Well, and that's what we're learning now. We're just becoming familiar with it. But just as belimumab became relatively popular in nephritis once it had that approval, I think the same thing can happen with anifrolumab. But in the meantime, given the history with rituximab, I expect obinutuzumab will be adopted fairly rapidly if and when it gets approved.
Mm-hmm.
And yet another mechanism of action. So all of these are important.
Yeah, and Dr. Radhakrishnan, I'm curious your thoughts on Saphnelo. We also, I did want to ask you about Gazyva or obinutuzumab, but just before we go to that, Saphnelo, any thoughts on the drug kind of currently or its potential in lupus nephritis?
No, it's a great question. So I think this